Specifically for the Latino population, and I'll say for this service area, we see a higher incidence of decay for numerous reasons, and probably the first and foremost is in the city that we're here today is Plant City. They do not have a water fluoridation system.
There's a large health disparity that we're finding among Latino and other ethnicities in our county. We're seeing that their children are unable to find a provider or find care. We've noticed that when the parents are required to bring them for their appointment, it's often a huge issue because of transportation or for the parents to miss work.
So we're not only seeing it in the Latino population, but other minority families that we service. And we know for a fact that on a state level, we know that the health disparities for minorities is compared to our Caucasian counterpart would be 2/3 less likely to access dental care. And so we know that there's a huge difference of that access to care.
Florida has a very low reimbursement rate for our Medicaid fees for our specialists. And in the 3 to 5 population, often the dentists who work for Suncoast have a very difficult time being able to provide care to those children. They require special management. They require a pediatric dentist, a dentist who attends a longer school to be able to provide care for pediatric dentist. And we find that it's very difficult to find a pediatric dentist in southeastern Hillsborough County who will provide services and accept Medicaid fees. Well, they should first start with talking to their elementary school principal and let the principal know that they would like to have these services in their school. And we are hoping to expand into our school district. We have not been allowed to so far, but we're hoping that if other people in the community and other members, principals and vice principals will ask for those services in their schools, then hopefully we'll be able to also be able to provide services to their schools.
Yeah, I would like to add that in the state of Florida, we have actually received an F from the Pew Foundation, and it said that out of the 50 states, Florida fails to provide a needs assessment. And it's a basic screening survey, and it's like anything in public health, you can't determine your outcomes if you don't first do your needs assessment. So we're working on a work group around the state to put together this data where we can go out into our community, do a needs assessment, and we have one place within the state to determine what our children, our school-age children, preschool children, what their needs are. And the other thing I expect to see that eventually we'll get our superintendent and our school district to agree for doing prevention in our high-risk school system or school district schools like our Title I schools, where we can go in and do early prevention. And I expect that's going to be coming on board. Many states already do it statewide. There's counties across the state that are doing this. But until we get the permission of our school district to go in and provide these services, we're still not there. So I expect that's what I'm going to see in the future.
And so with the mobile dental clinic, we're hoping to reduce some of those disparities by going and joining with the Boys and Girls Clubs, the Redland Christian Migrant Association, and other populations where children are located to provide dental services.
Other things in the future, which this has been an ongoing process, is to get more pediatricians to do the fluoride varnish at the healthy wellness checkups. And we've been pretty successful here in southeastern Hillsborough County in implementing an actual course for the physicians to do an oral risk assessment and apply fluoride varnish when the women bring their children in.
Our main goal in the mobile dental program is to reach children from 6 months old till seniors in high school. We actually are partnering with WIC, the Women and Children's a partnership that we've developed with Ken Harriman's, and we're actually seeing some pregnant mothers throughout the community as well.
Como si no tienen Medicaid o eso, pues es buena ayuda, le limpian los dientes, le hacen lo que necesitan.
The goal is to early intervention, and the earlier we can get to them as the first tooth in the mouth, that we're teaching mom about, you know, infant care of her child, to avoid putting the baby to bed with a bottle, making sure that she supervises and brushes their teeth up to age 7, and then also for them to practice good healthy behaviors. We're rolling out and trying to target young moms to teach them about overall, you know, dental affects their overall health, especially while they're pregnant. So we've been working on projects to target and educate young moms. So I expect that program to expand as well. So we have a lot of work to do. We're in our infancy, and so yes, I expect it to grow.